Hi, if you are a frontline healthcare worker, like a nurse or a PSW or an admin support staff or a research assistant or anyone who is into the hospital settings, long-term care, nursing homes or medical clinics and working tirelessly long hours, especially during these tumultuous times that what you are going through, and you are trying to take care of your patients, and in the end you're not able to take care of your own self. I've got a few things that I'd like to suggest for you, because most times what we see in groups of patients, people like those who are working either being on their feet all day long, having to continuously lift patients, transfer, move them over, or even constant prolonged sitting on a desk, and then having to continuously be able to do admin work. What we notice is people dealing with some lower back issues and some upper back discomfort. So if you are one amongst those and are dealing with this, we've kind of have classified these people into a lower cross syndrome. So it's basically, that means this core area is weak on those most people, and then glute is a little bit weak, and then our groin area and our lower back, these feel super tight. So it's like almost a cross of tight and weak and weak, and that's a cross syndrome that we've often found a little pattern of. And if that's you, there are a few things that I'd like to suggest for you. So for example, one exercise that you can do while you're sitting is having some weight in your hand and putting that weight onto the front area of your thigh, putting a lot of weight on it, and then slowly straightening your leg. Once you've got those trigger points, and then moving that area over and then doing these repetitively. This is a very slow exercise, 3 seconds of up and a 3 seconds of down with a lot of weight and a pressure on it. You can use a bar or a dumbbell weight or a kettlebell or any kind of weights that you could find. Doesn't really matter, but then going all the way from your groin all the way to the knee, and then doing these leg extensions 8 to 10 repetitions, and that should be helpful. Second exercise I'd suggest is with a ball. You could be in a position like this, and then with both your hands up on the top, and then you're trying to resist and push the ball. So with these knees, you're pushing the ball, pulling the ball here, and then with your hands, you're pushing it down and trying to maintain and fight that resistance. Throughout the time, you want to brace your abdominals and then keep that engaged, core engaged and tight. Do not hold your breath. 5 to 10 seconds of a hold like this, and 8 to 10 repetition. And that's super helpful for the area up here, and then it's going to get your back a little bit stronger. Third thing that I would suggest you do is working on your hips. It should work this way. So in a position like this, I want to do a march, go straight. Keeping this engaged. You do not want to increase the arch here, and that could strain your back. And then the fourth exercise, what I'd suggest, doing it for your upper back tightness and discomfort, is finding an area where you could have your hands clasped around and be in this kneeling position, and then trying to stretch that out. It's helpful. And then do some rotation, and then the other way as well. And you'd feel a lot of relief and a stretch and a mobility around that. So give that a go and see how that feels. If you find this helpful, and if you want to get more help, and is this something that you're dealing with, we've got an interesting event that's coming up on 2nd of February across all 6 of our clinic locations, where we are trying to say a thank you to all of our frontline healthcare workers by providing you a free one-on-one 30 minutes of an assessment, where we can help you find out the root cause of the problem that you're dealing with, and then also give you some successful treatment solutions so that you can start feeling better, getting back to things that you like, that is, taking care of your patients the way that you would like, without any limitations, without any problems, so that we are helping a larger cause there. And that's a little small thing that we would like to offer, and we can't wait to see you on February 2nd.